So our first presenter will be by Dr. Maramag, and then it will be followed by Dr. Kapada, and lastly by Sir Laplap from the St. Anthony Mother and Child. So that would be our sequence for this afternoon presentations.
Good afternoon, everyone. I am Dr. Regine Marie P. Baramag, a Medical Officer 4 from Southern Isabela Medical Center. Next slide, please. Melioidosis, also called Whitmer's disease, is a disease that is caused by gram-negative bacterium Burkholderia pseudomallei. These pathogenic bacteria causing melioidosis are acquired from contaminated water and soil. It is spread through direct contact and with contaminated source, mainly through percutaneous inoculation, inhalation, and ingestion. It commonly spreads through endemic areas during the rainy season, but outbreaks were also well recorded in dry areas due to contaminated water and soil. Unfortunately, melioidosis has no specific clinical manifestation, and for this reason, patients are often misdiagnosed, which causes delay in the management, which can lead to death. It is usually diagnosed by isolation and identification of the organism from the sputum, urine, tissues, blood samples, and wound exudates. This disease has variable manifestation ranging from localized abscess formation to disseminated abscesses, septicemia, shock, and death. And the lungs are the most common organ affected, and persons who are in immunocompromised state like diabetes and alcoholism are at increased risk of acquiring this infection. Next slide, please. The global distribution of Burkholderia pseudomallei and the burden of melioidosis remain poorly understood. There was an estimated 165,000 human melioidosis cases per year worldwide, from which 89,000 people die. Melioidosis is endemic in Southeast Asia and Northern Australia. However, sporadic cases have also been reported in our country and across the world. The increasing global interest in this disease was a consequence of the emerging number of documented cases and its potential role as an agent for bioterrorism. Next slide, please. The true burden of melioidosis in the Philippines is not well defined. The absence of surveillance system of melioidosis underestimates the impact of the disease in our country. A lack of awareness among physicians and lack of sufficient diagnostic workup are major obstacles in measuring the magnitude of the problem. Next slide, please. The first known case of melioidosis in the Philippines was documented in 1948. Indigenous cases are reported rarely, but underreporting is highly likely. A review of all published and unpublished cases of melioidosis in the Philippines done by San Martin et al. Last 2018 revealed a total 41 cases in the past 70 years, for which 23 indigenous cases and 18 cases involves travelers. Among the cases, the most common comorbidity is diabetes mellitus, and the most common clinical manifestations are pulmonary and soft tissue infections. The known recurrence rate is 4.9% and mortality rate is 14.6%. In this study, they mentioned that some cases were from areas with moderate to high rice production in the Philippines, including Isabela province as shown in the figure. Next slide, please. And for these reasons, we aim to identify the epidemiologic and clinical profile of cases of melioidosis, including its antibiotic sensitivity and resistance pattern among patients of Southern Isabela Medical Center, Santiago City. It further endeavors to determine the predisposing factors associated with melioidosis, the clinical and laboratory manifestations among these patients, and the demographic and seasonal distribution of this disease during the period of the study. Next slide, please. This is a descriptive study that was conducted at SAMCH, a 350-bed capacity tertiary hospital under the Department of Health located in Santiago, Isabela. The medical records of culture-proven cases of melioidosis admitted from January 1, 2017 to December 31, 2019 were reviewed and analyzed retrospectively to obtain the demographic, comorbidities, predisposing factors, clinical features, antibiotics given, and clinical outcomes of the patients. And lastly, antibiotic and susceptibility and resistance pattern were also included. Next slide, please. The patients were grouped according to age, gender, and location as per district and year admitted. Further, the month of admission of these patients were also recorded and were grouped into two. First, the rainy season, which coincides with the month of June to November, and dry season, which coincides for the month of December to May. Cases were categorized based on its clinical presentation and type of specimen, where Burkholderia pseudomallei was yielded positive. The collected data were coded and analyzed using descriptive statistics, frequency count, and the percentage to present the different characteristics of the study variables and to seek answers to the problems posed by the proponents. Next slide, please. We asked for the permission from the Ethics Review Board of the institution and informed consent addressed to medical records section and microbiological laboratory section of the hospital submitted under waiver of privacy authorization. And as per results, there were 56 patients diagnosed with melioidosis from year 2017 to 2019. The highest was in 2019 with 39 patients, followed by 2018 with 17 cases. Though the study commenced on year 2017, there was no record of diagnosed patient at that time since microbiologic workup were not routinely done due to the lack of clinical suspicion for the disease, and also for the lack of laboratory expertise to identify Burkholderia pseudomallei. The emergence of cases of melioidosis from 2018 to 2019 can be attributed to the fact that there's already a growing awareness and interest about the disease, prompting routine microbiologic workup, which is suspected cases. There was also an improvement in the laboratory technique in terms of microbial identification and antibiotic susceptibility testing as well. The availability of infectious disease specialists at this time have contributed to this effect. Next slide, please. Further, the mean age of melioidosis patients was 50.71, ranging from 24 to 74 years. Majority of the patients belong to age more than 45 years, which has been identified as independent risk factor for melioidosis as revealed by the study done by Curie et al. There were 43 male and 13 female patients. Almost three-fourths of the diagnosed patients were males. This result is probably attributed to the nature of work among male patients, which is more of occupational exposure, which might have placed them at greater risk of developing melioidosis. Further, this also corroborates with the studies of Curie et al., where 72.5% out of 364 cases of melioidosis were males. And also in the study of Maipong Chin, where 83.1% of 219 patients were also male. And half of the cases of melioidosis were from the 4th Legislative District, specifically from Santiago City and Jones with 28 cases, followed by the 3rd District with 14 cases, which are from Alicia, Cabatuan, Ramon, and Angadanan. The 6th District and 5th District has 11 and 3 cases, respectively. Based on geographical location, these are the areas where you can find a vast agricultural land intended for corn and rice fields. So most of the people here are farmers and other outdoor workers, which might have led to their exposure to bacteria in the environment, causing melioidosis. Climate may also affect the prevalence of cases among different districts. Both eastern Isabela and coastal Isabela experience moderate rainfall throughout the year, while western Isabela has more pronounced yet wet and dry seasons. Next slide, please. And as gleaned in this table, the month of June to November accounted the highest number of cases with 80.36%. Results coincide with the rainy season in the country, which is from the month of June to November. During this time, flooding is common, which may enhance dynamic dispersion of the organism in the environment and thus augments infective load in the surface of water and soil. This result is similar with the findings of Zubater in 2016 in Malaysia, where 67 out of 158 cases were presented during the monsoonal wet season. Next slide, please. As to comorbidities and predisposing factors of melioidosis, diabetes mellitus with 62.5% had the highest occurrence among diagnosed patients, followed by CKD, exposure to soil, cardiovascular disease, and pulmonary tuberculosis, among others. It can be inferred from here that they become more vulnerable to infection due to their weakened immune system. The case study conducted in Thailand by Suputamangkol et al. On risk factors for melioidosis pointed out that diabetes mellitus, pre-existing renal diseases, thalassemia, and occupational exposure classified by the Soil and Water Risk Assessment were confirmed to be significant risk factors for melioidosis and bacteremic melioidosis. Based on this result, it is therefore imperative to give equal medical attention to predisposing factors among patients, for this disease is fatal if not properly attended and treated. And the top 5 common presenting signs and symptoms were non-specific. Among patients diagnosed with melioidosis are fever with 98.21%, body weakness with 42.86%, followed by anorexia, hypotension, cough, and abdominal pain with same frequency. Next slide, please. Next po. Okay. Results reveal that melioidosis can present with different clinical manifestations. Almost 3/4 have septicemia with 80.36%, while other clinical findings are shock, pneumonia, UTI, predominantly as prostatitis among male patients, followed by soft tissue abscess in different sites, like head, neck, psoas muscle, and scrotum. 29 patients have no clinical focus but only septicemia. Septicemia is the leading case among diagnosed patients with melioidosis, since the nature of infection occurs when bacteria enter the bloodstream, which has seen as the route of bacterial entry. On the other hand, pneumonia is the most common presenting feature of melioidosis and more frequently developed into septic shock. Lastly, due to infection in the bloodstream caused by Burkholderia pseudomalae, other body parts are affected, which are evident by diagnostic findings of abscesses and inflammation in the different parts of the body of the patients, like spleen and liver. Several specimens were collected and subjected to routine culture to accurately determine the presence of Burkholderia pseudomalae. 45 cases were tested positive from the samples, 8 through urine, 6 with sputum and abscess, 3 through synovial, and 1 by cutaneous aspirate. Analysis of the data revealed that the most common specimen being used for routine culture and laboratory tests is blood specimen, since it is the most convenient procedure to collect the sample as compared to other specimens like abscess pus, synovial fluid, and cutaneous aspirate. Next slide, please. As to treatment outcome of patients with melioidosis, 51.79% improved. Unfortunately, 32.14 patients died. Patients went home against medical advice by 8.93%, and 7.14% of the cases were readmitted. The data revealed that 51.79% outcome is considered success rate of the initial treatment among 56 cases, while the 48.21% can be the basis for the improvement of the treatment program, specifically on the cases of deaths. There are many underlying factors as to success or effectiveness of managing this disease. One consideration was clearly pointed out by Bersinga et al. The treatments requires long-term IV and oral antibiotic courses, and also the delays in treatment due to difficulties in clinical recognition and laboratory diagnosis often lead to poor outcomes, and mortality can exceed as high as 40% in some regions. Next slide, please. The isolates from the patients was sensitive to meropenem, ceftazidime, patrimoxazole, levofloxacin, norfloxacin, and nitrofurantoin. Patients were treated according to their sensitivity patterns and based on recommended antibiotics regimen in the management of melioidosis. Further analysis revealed that majority of patients received parenteral ceftazidime and meropenem for intensive phase, followed by oral patrimoxazole for eradication phase. Next slide, please. Based on the findings of the study, the following are concluded. There was an emergence of cases of melioidosis in 2019 due to the growing awareness and interest in the disease. The mean age of patients is 50.71, and majority of the patients were male. Half the number of patients were from the 4th Legislative District, specifically from Santiago City and Jones, and the months of June to November, which coincides with the Philippines rainy season, accounted the highest number of cases of melioidosis. Next slide, please. Diabetes mellitus was the most common comorbidity, and most common signs and symptoms are nonspecific, which poses a diagnostic challenge. Melioidosis has varying manifestations, and majority of the patients were bacteremic, with or without clinical focus. Next slide, please. The outcome of treatment among patients is quite acceptable considering other factors in the treatment management. Isolates from all patients were sensitive to ceftazidime, meropenem, and cotrimoxazole, which are part of the standard treatment regimen for melioidosis. There was no recorded resistance among patients at SIMC. Next slide, please. Based on the findings and conclusion, the following are strongly recommended. A massive campaign on the disease must be undertaken due to its nature of tricky diagnosis and potential threats in the province of Isabela. The farmers, specifically in immunocompromised state, will be the most appropriate population group for control measures due to the nature of their work. There should be an increase in the awareness of melioidosis among clinicians and clinical microbiologists and improve laboratory facilities for the selective isolation and accurate identification of Burkholderia pseudomallei. Epidemiologic studies on melioidosis should be conducted to establish its prevalence. This will help in clinching early diagnosis since successful treatment by antibiotics is highly attainable. That would be all. Thank you.
Female reproduction and general physical health functions decrease with age, and different ages involve different risks during pregnancy. Studies have shown and associated advanced maternal age with increased risk for several adverse pregnancy outcomes. Hence, I am here today to present my research entitled The Association of Advanced Maternal Age with Adverse Pregnancy Outcome in a Tertiary Government Hospital, a retrospective cohort study. Good day. As we all know, advanced maternal age is associated with increased risk for a wide range of adverse pregnancy outcomes, and it is said that the optimal age for pregnancy is at 20 to 34 years. And according to a study among Asian women, there is nearly a 1.5-fold increased risk for pregnancy complications and a 1.6 to 2.6-fold increased risk for adverse perinatal outcomes in advanced maternal age. It has become more common in both developed and developing countries over the last decade. However, multiple studies are inconsistent with associations of advanced maternal age and adverse maternal complications. Hence, the paper aims to investigate pregnancy complications and adverse pregnancy outcomes in a via retrospective cohort study. Again, this is a retrospective cohort study of all advanced maternal age and 20 to 34 years old as a control group who delivered at a tertiary government hospital in Caloocan City from January 1 to December 31 of 2019. These included all pregnant of more than or equal to 20 years of age from 11 weeks each of gestation until delivery, and the respective neonates admitted under charity service from January 1 to December 31 of 2019. Systematic sampling with confidence level of 95% was used. Inclusion and exclusion criteria was followed with strict confidentiality. Logistic regression analysis was used as data analysis. As a result, study population consisted of 2,186 pregnant women with age ranging from 20 to 50 years old. 77.4% of the total cases belong to the age group of 20 to 34 years old. And among the age group of advanced maternal age, there are more pregnant women at 35 to 39 years old. The study shows that majority of the subjects, which represents 76.9% of the population, have completed 2 or more viable pregnancies. It can also be observed that most mothers are multiparous among different age groups. Among the multipara, 20 to 34 years old had the highest percentage at 54.6%, while the advanced maternal age of 35 to 50 years old at 22.3%. This shows that more women have started getting pregnant at a younger age nowadays than women during the previous generation. This table represents the effect of maternal age on various parameters such as birth weight, Apgar score, and perinatal outcome. From the results, it is shown that maternal age has significant effect on birth weight and perinatal outcome upon delivery. The statistics p-value of 0.11 signifies that there was no significant difference in the Apgar score of neonates among the different maternal age group. Normal birth weight was observed highest among neonates in the 20 to 34 years old group at 72%. For the more than 4,000 grams birth weight, this shows that this was higher in the neonates of mothers in the advanced maternal age, which represents 2% of mothers in 35 to 50 years old in comparison to 0.8% representation among the younger age group. Miscarriage was observed highest in the advanced maternal age per sample size, which represent 12.5% compared to 9.5% for the 20 to 34 years old. Both age group have 2% rate of stillbirth per sample size. This shows that stillbirth pregnancy outcome has no difference among the different age group in contrast to the slight differences observed in the live birth and miscarriages. With p-value of 0.042, this denotes that maternal age has significant effect in the perinatal outcome. As age advances, pregnancy-related complications tend to occur and were found to increase linearly with maternal age. From the results, the highest pregnancy complications seen in both age group was pregnancy-related hypertensive disorder, which is observed in 10% of the total population. It was highest in the advanced maternal age, which is 18%, while it represents 7.5% in the younger age group. This was followed by premature delivery at 4.4%, which is slightly higher than postpartum hemorrhage at 3.8% of the total population, both of which is seen to be observed more on the younger age group of 20 to 34 years old at 4.6% in premature delivery and 4.2% in postpartum hemorrhage. Among the advanced maternal age group, premature delivery and postpartum hemorrhage is slightly lower at 3.7% and 2.7% respectively. As a conclusion, in the Philippines, women aged 25 to 49 years old initiate sexual intercourse at the median age of 21.2 years. This indicates that more women are getting pregnant at a younger age group than the previous generations. Furthermore, there is also lesser chances of getting pregnant if the mother is already in the advanced maternal age as observed in the study, which shows that most pregnant women are within the age of 20 to 34 years old. Neonatal outcome with more than 4,000 grams were seen more on mothers in the advanced maternal age. Low birth weight babies, on the other hand, had only minor differences between age groups. The study also shows that age has significant effect on increasing risk for miscarriage. The study supported the association of increasing maternal age with the likelihood of occurrence of pregnancy-related adverse complications, especially in pregnancy-related hypertensive disorders. Whereas the study also concluded that there is decreasing odds of preterm delivery and postpartum hemorrhage with increasing age that can be attributed to reduced uterine vascularity with aging. This concludes my presentation. Thank you.
Good afternoon, everyone. My study is about the expanded program on immunization at SAMCH in the new normal. My name is Zachary John Nuez Laplap, a nurse 3 from the same institution being studied. Generally, parents or guardians desire everything possible to ensure that the health of their infants or children is excellent. However, newborn and older children are subject to diseases and infections. In the case of disease prevention, relevant vaccines are available for all persons, especially those who are at risk, to control disease and achieve better health for all people. In the case of SAMCH, immunization protects children from life-threatening illnesses and complications of preventable diseases, wherein DOH, through the expanded program on immunization, remains committed to the universal health access for all Filipinos. This study is anchored on the Republic Act 10152, or the Mandatory Infants and Children Health Immunization Act of 2011. The mandate includes basic immunization for children below 5 years of age. During the first quarter of 2020, COVID-19 cases proliferated in Cebu, and many establishments, including outpatient departments of different hospitals, medical clinics, and health centers, closed their operations. Despite the fear and threats, the outpatient department of SAMCH has continued serving the public, including the implementation of DOH programs, and that includes the EPI. The statement of the problem. This study looked into the performance of the expanded program on immunization at St. Anthony Mother and Child Hospital prior and during the pandemic as basis in proposing an enhancement of the program implementation in the new normal. Specifically, the study aimed to address or answer the following queries. First, what is the performance of the EPI in terms of its goals, focusing on the identified preventable diseases? Second, what are the challenges faced in the implementation of EPI in the new normal? And third, based on the findings, what appropriate action may be proposed to enhance the implementation of the said program in the new normal? Methodology. So the researcher utilized a quantitative research method through a descriptive study. And this study was conducted in St. Anthony Mother and Child Hospital in Cebu City, which is a DOH-retained specialty hospital that offers accessible, equitable, sustainable, and quality maternal and child healthcare services. Through this study, the researcher used secondary data collection method. The researcher collected, analyzed, and interpreted data through the secondary sources by analyzing the accomplishment report provided by the medical records section of SAMCH through the EPI unit of the OPD. The study also employed an interview method through an interview guide that addressed the challenges faced in the implementation of EPI in the new normal. Now, for the results and discussions. So infants who receive 1 dose of BCG and 3 doses each of OPV, DPT, and hepatitis B vaccines, and 1 dose of measles vaccines before reaching 1 year of age are considered to be fully immunized child. Now, Figure 1 reflects the fully immunized children in SAMCH from 2018 to 2020, wherein the data portrays that in 2018, more than 600 children attained their fully immunized child status. The number of children classified as fully immunized child surged up to more than 800 babies, or an increase of 36.49% in 2019. On the other hand, during the start of the pandemic in 2020, the number of fully immunized children plummeted to 451 babies, equivalent to a decrease of 48.69%. So this would show the effect of the pandemic in the accomplishment in terms of the goal on immunizing infants or children against the common vaccine-preventable diseases. The EPI performance depends on the implementation of its goals as manifested in its immunization accomplishments on the identified preventable diseases. So Figure 2 shows the vaccination accomplishments in SAMCH from 2018 to 2020. In terms of sustainability of the polio-free status, almost 1,200 infants were vaccinated with OPV in 2018. The data decreased gradually to 1,132, or 4% in 2019. Surprisingly, the data rose to 1,684, or 48.76% in the year 2020. On the other hand, 392 infants were inoculated with the IPV in 2018, which is injected together with a third dose of the OPV. The data dropped to 323, or 17.6% in 2019 before the pandemic began. The data increased marginally to 5.88% in 2020 when the pandemic took place. Ever since the pandemic started, the number of children immunized with OPV and IPV increased significantly in SAMCH. Now, in 2018, 644 infants were vaccinated with measles-containing vaccines. The data surged to 879 infants, or 36.49% in 2019, before the pandemic commenced. However, the data remarkably reduced to 451, or 48.69% in 2020 when the pandemic began. Now, the initial dose of hepatitis B vaccine is usually given at birth, and data would show that in 2018, 2,094 infants were injected with Hep B vaccine. In 2019, the year before the pandemic, the data increased to 2,382 infants, or 13.75% from the previous year. The data increased significantly at 71.41% in 2020, wherein 4,083 infants were inoculated with the hepatitis B vaccine. Moreover, data would also show that in 2018, 1,183 infants were vaccinated with pentavalent vaccine. However, the numbers slightly declined by 4%, or 1,134 infants before the pandemic arose in 2019. Unpredictably, the data intensified with an increase of 46%, or 1,656 infants when the COVID-19 pandemic surged in 2020. This is more or less the same pattern as that of the polio vaccine, in as much as these are administered at the same time. Now, in terms of prevention of extrapulmonary tuberculosis, the number of infants inoculated with BCG vaccine in 2018 were 1,233, and the number continued to swell by 52.39% in 2019, wherein 1,879 infants were vaccinated with the said vaccines before the pandemic. The data increased exponentially by 94.52%, or 3,655 when the pandemic started in 2020. The number of infants vaccinated with a PCV13 in 2018 were 1,150, and the number increased by 5.82% in 2019, wherein 1,217 infants were vaccinated before the pandemic. The data continued to rise to 1,698 in 2020, a 39.52% increase during the pandemic. Now, in the implementation of the EPI, SAMCH, just like any other health centers or hospitals, has faced challenges in the new normal. First is the observance of standard health protocols in the vaccination of children, which requires strict observance for both patients and, of course, the implementers. So, for the second problem is the difficulties in administering the vaccine wearing face shields along with a face mask, as well as in giving thorough instruction for health education after vaccination. Third is the concern regarding the number of patients that would enter the OPD at the same time, which required social distancing. And the delay in the procurement process also caused a delay in the implementation of the program during the pandemic. Some parents were hesitant to bring their children for immunization due to misinformation. However, some parents really believed in the importance of immunization, but missed to come as scheduled due to some limitations like fear of the virus, unavailability of transportation, lockdown in their areas, among others. For the conclusion, SAMCH has made a considerable accomplishment in the EPI implementation in the past 3 years in terms of its goals, focusing on the identified preventable diseases in spite of the pandemic, as reflected in the vaccines administered during the initial months of the infants due to the fact that mothers were already informed during their prenatal classes regarding the importance of immunization. In addition, SAMCH EPI did not only cater to patients born in the hospital, but also to other patients coming from different parts of Cebu due to the closure of other outpatient clinics and health centers. However, for vaccines administered in the later month of the infants, there was a slight decline due to the fact that some of their schedules were still set in the following year. Moreover, more stringent protocol for the community quarantine level was issued, which was consequently expected to affect the profile of the infants or children with full immunization status. The pandemic has offered a lot of challenges in the implementation of EPI for both the implementers and the parents or guardians. However, SAMCH continued to serve the public in line with the Republic Act 10152 to administer basic immunization for children below 5 years of age. Taking into account the significant findings of the study and after a thorough investigation, On the EPI, the researcher fosters the following recommendations to further improve EPI coverage in SAMCH. First is to adopt a sustainable mobilization strategy like digitizing health education activities. So this could be done by conducting health education through digital means for parents or guardians, emphasizing the importance of immunization even during the pandemic. And utilization of social media and digitization through internet, radio, TV, and others to fortify the information dissemination with less face-to-face exposure. Second is to fortify data management and disease surveillance through the use of ICT like Google Docs, Excel, for easy recording, reporting, and retrieval of data. Third is to eradicate dropouts and missed opportunities involving coordinating with LGUs and local health centers. Fourth is procurement process streamlining. So in observance of ease of doing business, streamlining of procurement process may be employed for faster and simpler method of requisition of vaccines. And lastly, to utilize new normal strategies in the EPI implementation. So the vaccinator shall wear appropriate PPEs with anti-fog face shield for clarity in administering the vaccine. Protective barriers or acrylic partition with armhole may be installed for vaccine administration. And limiting the number of patients inside the OPD and providing a waiting area for others while proper labels for social distancing. So this is an example of the proposed enhancement of the EPI implementation in the new normal. So this is actually based on the Blue Ocean strategy. Despite the pandemic, I hope that this study would make many realize that the hospitals are truly the sandigan at kaagapay ng mga Pilipino with regard to expanded program on immunization. That ends my presentation. Thank you for your time and have a great day ahead.
Much Dr. Laplap for that very timely research papers on the new normal about the API or the expanded program on immunization. So at this juncture, we will have a question and answer part of this session. So may we call Mr. Orven Villaruel if there are some questions in the chat box that you can read for the presenters this afternoon.
Hello, good afternoon. Pwede na po kayo mag-ask ng questions. Open up ang floor for your questions. Sa ngayon po sa chat box natin, wala pong questions na raised.
Questions? Can I throw questions to the presenters? Maybe for some clarifications, may I ask for the presenters, especially on the association of the advanced maternal age with adverse pregnancy outcome? For Dr. Capada, may we know what are the possible recommendations for your paper in terms of the hospital operations?
Hello? Can I be heard po? Am I
Yes,
good?
ma'am.
You can be heard po.
Okay. Regarding my research, I just want to emphasize the importance of proper antepartum and intrapartum monitoring in terms of patients or pregnant patients, especially in the advanced maternal age, because at this group, they are vulnerable for complications. Because as an OB, I've noticed that more researchers are focused on the teenage pregnancy. There are more programs about the teenage pregnancies, because yes, it gives it is an issue regarding there are more teens that are having pregnant. However, I think we're losing our focus or losing our interest with the advanced maternal age, whereas just because more doctors are expecting that there are complications. However, still we should give importance with them in the monitoring in pregnancies.
Much po, Dr. Capada, for that answer. For Dr. Maramag and for Dr. Laplap. May we ask, what are the challenges you encountered during the implementation of your researches, especially during these times of of a pandemic? To answer Dr. Laplap, then to be followed by Dr. Maramag.
Okay,
Yeah.
thank you for that wonderful question, Sir Rod. At first, it was really difficult for us to implement the API, especially with the increasing number of patients, because other health facilities were closed. So patients were flocking in St. Anthony Mother and Child Hospital, and at first, it was really difficult because of the surge. However, with the help of the administration and with the with the support of the staff, we were able to overcome it. And thankfully, the patients were very supportive. They were able to follow the instructions given to them. And I would just like to add, Sir Rod, that this study is very close to my heart because it is very timely and relevant. Because despite the pandemic, Sir Rod, vaccine preventable diseases are still rampant. If we stop the provision of these vaccines, other diseases could possibly rise, and we will have another problem in the community when this happens. Thus, I believe that this study is very important in this trying time because these diseases can still be prevented through these vaccines, and especially now that COVID-19 vaccination is a hot issue, it is but important to pursue studies like this and enhance policies to adopt in the new normal.
Doc Laplap for that very answer, no, very comprehensive answer. I think there's a follow-up questions from
Sir Rod?
Slanga.
Sir Rod? Sir Rod?
Yes, Sir Ben.
Yes, sir. May question po tayo para po kay Sir Zachary from St. Anthony Mothers and Child from Jonah Lianga. What can you recommend on EPI with national targets?
Yes, thank you for that question. One thing that I can recommend is through the eradication of dropouts and missed opportunities. So this would involve coordinating with LGUs and local health centers, and at the same time, um, as mentioned earlier, improving the procurement process. I mean, streamlining the procurement process, because one of the problems that we encountered last year was the delay in the procurement and the requisition of the vaccines, which also caused delay in the implementation of the said program. So in observance of that, as I mentioned earlier, ease of doing business, streamlining of procurement process may also be employed for faster and simpler method of requisition of vaccines. So I hope that answers the question.
Answer Dr. Laplap. Maybe we have last question for Dr. Maramag. What are the challenges that you have encountered in terms of your implementation of your research paper po? So that we can also learn from maybe some of your strategies on how did you finish the paper.
Good afternoon. Maybe I'm just blessed enough to that I was able to finish this paper before the COVID pandemic. But I think one of the challenges that I've encountered, especially not just about my paper, but also the awareness of melioidosis, because sobrang bago po ito eh. Parang siyang nag-emerge pa lang po siya na disease, starting to be recognized by our institution. However, due to the pandemic, nagkaroon ng hindrance dun sa recognition nitong sakit na to, because we have to accept that we are very focused right now on the pandemic, on the COVID, and it's very difficult na isama itong sakit na to, itong endemic na sakit na ito sa nangyayari ngayon dito sa atin, especially dito sa Philippines. So those are the things that I would like to emphasize.
that we should not take this for granted, because I've mentioned a while ago the mere fact that we misdiagnose this case, it could increase the mortality in our patients. Thank you.
For Dr. Maramag for that answer. So before we'll end, I'll give you some synthesis of this presentation. Since this is a hospital statistics, the term statistics has two meanings, no? First, it is the number computed from a larger group of numbers which collectively constitute a sample of data. For instance, we compute for the bed occupancy rate or the average occupancy, daily occupancy of the hospital, no? Then, second, statistics is more broadly defined as branch of mathematics, no, concerned with collecting, organizing, summarizing, and analyzing data. Originally, the term statistics referred to the collection of data about and for the state. The word comes from the Italian word statu, meaning state. One need only think of our own government and its statistics collecting organizations, like the Health Facility Services and Regulatory Bureau, for instance, for our hospital operations, our Epidemiology Bureau in terms of the health statistics, our Philippine Statistics Authority, and the like. Health statistics provide information about the health of the people and their use of healthcare services. So we heard a lot of paper this afternoon. It entails and talks about the different novel statistics. I'm very happy to note that one of the paper on the melioidosis talks about epidemiology and clinical profile, as well as antibiotic sensitivity and resistance. The study revealed that there was an emergence in the cases of melioidosis, in 2018, as well as it increased in 2019. So its growing awareness and improving micrologic technique in the institution is highly needed. So there were also observations about the that majority of the cases were male, and the mean age at 50 years old, so already an adult. And common commodities and predisposing factors were identified in this study. There's need to increase awareness according to our recommendations, and I'm happy to note that there's need and more need for improvement, especially on the laboratory facilities for the selective isolation and accurate identification of the isolates. And since our bureau, the Health Facility Development Bureau, is organizing the Office for Health Laboratories, I think this is very timely, that maybe in the future, part of these findings is justification for extension of the national reference laboratories or sub-national reference laboratories in terms of isolating this type of disease. And hopefully, the Southern Isabela Medical Center would be part of this network of highly specialized laboratories, specifically on the amyloidosis. On the second paper, authored by Dr. Capada and Dr. Olivar, it talks about the association of advanced maternal age with adverse pregnancy. We concurred that there's a growing need also for research papers as well as statistics on this area. Based on the study, it showed that majority of the pregnant women are within 20 to 30 years, which represents 77% of the total population. Among this age group, majority are multiparous, which indicates that more women are getting pregnant at a younger age than the previous generations. Furthermore, it was also observed that there's lesser chances of getting pregnant if the woman is already in the advanced maternal age. Majority of the neonates of the younger age group, 20 to 34 years old, have birth weights within the normal range. However, neonates with birth rate of more than 4,000 grams or 4 kilograms have seen more advanced maternal age groups. So with this paper will also improve our health system's capacity, in terms of guiding our clinicians in treating patients, especially with advanced age, during pregnancy. For our third paper on the expanded program on immunization at the St. Anthony Mother and Child Hospital in Cebu City in the new normal, which is authored by Dr. Laplap, it provides us the information about the situation during the pandemic, especially that expanded immunization is very important for the population. There was a decrease based on the study in the number of infants, children fully immunized against the most common vaccine preventable diseases as affected by the pandemic, as well as other immunizations scheduled for administration among infants, children had also increased, such as oral polio vaccine, the pentavalent vaccine, the pneumococcal vaccine, as well as BCG, due to the fact that SMCH has opened with the vaccination centers even closed during pandemic. The API faced a lot of challenges, especially in terms of logistics, kasi we observe a lot of factors, especially in the delivery of the vaccines as well as collaterals for vaccinations. So it is good that this paper identified several recommendations, especially in improving the procurement process, as we note that it's have a great role in terms of the delivery of services, especially the vaccination. It also identified that sustainable mobilization strategies in communities, as well as fortification of data management, digitization of our health education activities, as well as utilization of new normal, are also very important strategies that we need to improve further, that to ensure that everybody will not be left behind, despite the pandemic. So these three papers are all very timely, and it would contribute to the body of knowledge, and it would definitely improve our healthcare systems. So again, congratulations po to all of our presenters this afternoon, to Dr. Laplap from SAMCH, to Dr. Maramag from Southern Isabela Medical Center, and as well as to Dr. Capada and team from Dr. Jose and Rodriguez Memorial Hospital and Sanitarium. Thank you so much for all your courage and all your dedication for the research, in terms of formulating as well as implementing researches. So bihira po tayong makakita ng mga doktor that willing to pursue and present their papers, in the forum like this. So again, congratulations and thank you po.